Watson Motors, Lakeshore Automotive and Tire, McGee Insurance, and West Michigan CMH on 102.7 Mom FM.
It is 7:29 now, and good morning, West Michigan. Chris here with you, and so is Dr. Brandon Riemer from Riemer Eye Center this morning. Doctor, how you doing today?
I'm doing well. How about yourself?
I'm doing okay, and always I actually get to do my own testimonial because I go to Riemer Eye Center, and glasses ordered, contacts ordered from there, from you, and also some procedures from time to time on my eyelids, and you know what? The team is always super friendly. And it's very quick turnaround there. So the attention is there, but the quick turnaround. You know my busy schedule, and so I was there just yesterday, and 15-20 minutes back out the door. So I appreciate all that you guys do there.
Absolutely.
And it sounds like the expansion. I think is it Whitehall or Shelby is going to be a location near
Whitehall area.
Whitehall.
Yep.
Okay. All right. So looking forward to that, and for our listeners down in that neck of the woods to be able to go to Riemer Eye Center. Let's talk over the next few minutes. If you're just joining us, by the way, you can listen to this segment on your radio, on your smart devices like your Amazon Alexa, your Google Home. We're streaming it at WMOM.FM. Just click the play button there. And then you can watch this segment right now on our Facebook page and our YouTube channel. We're streaming live on both of those platforms. Macular degeneration. I'm sure that I've heard that term over time. But the terms that I hear, because I wear contacts, Brandon, is that, don't wear your contacts too long because you can deprive oxygen to your eyes and such. But that's totally different from macular degeneration, right?
Correct. That's more the surface of the eye. And when we talk about macular degeneration, we're talking about the retina, kind of the seeing tissue that's the very back part inside of the eye that gets damaged with time.
So we have the lens on the outside, right? Mm-hmm. Okay. And then go through the layers if you don't mind, so we can zone in on what that is going to be part of this topic then.
Yeah, so it's starting with the kind of front part of the eye. You have your cornea. Behind that cornea, you have your iris, the color part of the eye.
Okay.
And tucked behind that is the lens of your eye. And then in the very back part of the eye, you have the retina, and kind of the center spot we're talking about, your central vision, is your macula.
Okay. All right. So, and how can that become damaged over time then?
Yeah, with macular degeneration, there's really two forms of it. There's a dry form and a wet form. The dry form is much more common. About 80 to 90% of the patients who have that diagnosis have the dry form of the disease, which is the better form to have. It's very slowly takes the center part of your vision, starts out with some blurring or smudging in the vision, and then can end to a kind of missing or a black spot right in the center spot of the vision. It's a gradual destruction of that retina, that seeing tissue of the macula in the back part of the eye, and causes a thinning of that area. With wet macular degeneration, the other form, that's a much more quickly destroying area. It causes little blood vessels to grow underneath the retina, causes leaking and bleeding and scarring, which can take that central vision much more quickly.
And the question I've asked you many times when you've been here in the studio is this, and I say the word reversible, but in more times it's more just treatable, but is reversible even part of that conversation?
No. So once the damage is done, it's done. There's no bringing that retina tissue back or healing it, regenerating it. So really the goal is preventative, or trying to reduce the progression or slow down the disease. Wet macular degeneration has some treatments for it. That's maybe people have heard of the injections of medicine in the eye. And that can slow down the bleeding and leaking, but often we can't get all the vision back once there's scarring that's there. So we try to slow it down or reduce that vision loss as much as possible.
All right, so this scares me. It freaks me out, I'll be honest with you. With the injections in the eye, what is that like?
We numb the eye up pretty well, and I'm pretty sneaky, so really people don't see anything pokey coming at them.
Okay.
I have many patients I do injections on. They'll ask me when I'm going to do the injection, and we're already done.
Wow, okay, yeah. All right. How do you numb an eye without numbing it with a
Well, I numb it kind of a three-step process. So I got to put eye drops on the eye that kind of numbs the surface of the eye, and then I put a little cotton tip that has some stronger numbing medicine over the area where we want to inject, and then I do a very tiny little needle. We inject a little bit of numbing medicine underneath the clear skin of the eye called the conjunctiva, and that seems to numb people quite well.
Wow. And before they ask, you're done.
Yeah.
Wow. That's very impressive in that sense. Okay, so let's reverse time just a little bit here in regards to some of these questions. And by the way, if you're just joining us, we're talking with Dr. Brandon Riemer this morning from Riemer Eye Center. First of all, there has to be some sort of cause to this. And I guess it's a kind of a two-part question. Is it a genetic sort of thing, or is it something that we are doing in our lives that we're contributing to this?
Yeah, I think it's really a culmination of multiple factors, and you touched on two of the big ones, is there is a genetic inheritance to it. Thus far, there is no gene therapy for it, and there are some gene testing. I think they found about 30 different genes that are correlated with macular degeneration, but thus far, no targeted treatment for those genes. And then additionally, there's race is one, so Caucasian people are at higher risk for it. As we age, we're at higher risk for it, so it's a gradual destruction over time. And then general health. So if, obesity, heart disease, those things all increase your risk of macular degeneration. So kind of lifestyle and overall health modification helps reduce your risk and slow the progression of the disease.
When a patient is there with you, do you have those kind of conversations with them, or is that part of their healthcare provider, like their family physician? Do you kind of work together there? Or what is the path of at least guidance for them?
Yeah, I think it's a little bit of both, is talking about kind of their main risk factors that we have and modifying those. There are some vitamins that also help with treatment or help slow down the progression. They're called AREDS 2 vitamins. Many people, kind of common names are Preservision, Ocuvite, or iCaps. And those vitamins have been shown through a large study that can help slow down the progression of the disease, particularly in kind of intermediate and advanced stages. It slows it down and reduces the risk of going from the dry form of the disease to the wet form of the disease.
Okay, so and that is a good message there, is that with these two paths of dry and wet form of disease, it's not always dry leads into wet. You could start with the wet form of the disease, right?
Yeah, so some patients present with wet because they had no idea that they had the dry macular degeneration. Okay. So some of that blurring or central vision loss can happen in the later stages, often when it's intermediate or advanced, and they may have had it for several years but had never had an eye exam or never noticed that. So that's one of the key things, is getting an early eye exam so that you can make those lifestyle modifications, get on vitamins, protect the eyes, to try to slow that progression right off the bat.
And with your eye exams that you get on a regular basis, you're checking for this. This is part of the exam then.
You bet. That's one of the main things we do, is we're looking, when we do our dilated exam, looking very closely at the retina. We have also other testing that helps us, diagnose and track macular degeneration, those being our OCT scans. We can scan and see that fine nerve layer, looking for those little protein deposits called drusen, or looking for any fluid or blood vessels growing. We have fluorescein angiograms. We'd inject a little vegetable dye into your vein, and we watch it flow through the eye with special cameras, and it can highlight areas of leaking blood vessels or areas of damage or scarring.
And you have this technology right there at Riemer Eye Center.
You bet.
Wow, that. Things have changed, haven't they, over the years? Pretty impressive. The big question that comes up is, when you are diagnosing somebody with this, is it kind of the, hey, there's a time frame that's going to happen now where ultimately they'll lose their vision, or is this something that you can kind of keep at bay for a long time?
Yeah, it's a tough conversation, is that they have a disease that's going to eventually steal your center of vision. It's typically quite slow, and we try to slow that down as much as possible. So we kind of have that conversation, is that things may start to get fuzzy or blurry or gray, and people start to notice harder time seeing the distance or near, or doing fine tasks like reading. But our goal is to try to slow that down as much as possible to maintain as good vision or useful vision as long as possible. Another thing of note is it's never lights out black, that you can't see anything with macular degeneration. It's typically a blob or a black spot right in the center, but your peripheral vision remains unchanged. So you still have good peripheral vision, can still get around and function, but really doing those fine motor tasks was what becomes quite difficult.
Okay, good points there. And as we wrap up this morning, so we're seeing that black dot, or that vision. It can, I know this is going to sound weird, but can others see a difference in our eyes when we have a disease like this? Because, sometimes, you get kind of colored eyes and stuff like that. Is this part of that disease or no?
No, people wouldn't notice really looking at the eye. It's very tucked back in the very, very back part of the eye. So the only way to really look at it or see it is with our high-power microscopes and special lenses to look into the back part of the eye.
Okay, that makes sense. Anything we missed talking about in regards to this? I know you kind of hinted that it's kind of an older demographic progression there. Can younger individuals still develop this disease, or is it primarily an older generation?
Primarily older generation. Over 50, over 60 is most common. The big thing that really would touch on is the importance of having those eye exams and making sure that we're catching it early, especially if you have a family history, that it's important to get in to make sure we watch those things and catch them. And if we notice things are getting really wavy or distorted in your vision, the concern would be about fluid or swelling in the back part of the eye, and get in right away to get that treated.
All right. And as always, a regular eye exam is important, in general, right?
Absolutely. We sometimes can catch signs of wet macular degeneration very early on before it causes all the scarring and damage, and can treat it with those injections here in town before the people lose a lot of their vision.
And is it kind of like the dentist we go on a regular basis? What is your recommendation in regards to going to see your eye doctor? And it's, again, two-part question. If you don't have any eye issues, you don't wear contacts, you don't wear glasses, should it still be a part of those checkups from time to time?
Yeah, everybody should have a complete eye exam or dilated eye exam by the age of 40. And really my recommendation, anyone over the age of 65 should have an annual eye exam, regardless of their eye health. Now, if you have eye disease or eye problems, you're going to be seen a lot more frequently, depending on what your specific condition is, that will kind of decide your regimen of how quickly or how soon we need to see you.
All right, good information there. Anything else that we missed talking about as we wrap up this morning?
I think we got most of it. I'm just happy to see patients, and if you have any questions, concerns, come on in. We can take a look and make sure there's no problems going on.
Absolutely. Riemer Eye Center there off of Lawndale, also located Manistee and Cadillac, the 3 locations. Is there any other locations that I forgot about?
That's all of them for now.
Okay, and the Whitehall coming in soon. Do we know a kind of a time frame on that one at all? Or is it...
Still to be determined.
Okay, that's all right. We're looking forward to it. Dr. Brandon Riemer with Riemer Eye Center. We appreciate you coming in this morning.
Thanks for having me.
Absolutely. It is 7:41 now here on 102.7 Mom FM. Coming up after this song, we're going to play What's in the Box, presented by West Shore Bank. Stick around for it. It's up next on 102.7. It's Mom FM.
Sports on the Michigan News Network.
Mandatory Lions minicamp underway